Obesity. Obesity is defined as accumulation of adipose tissue that is of sufficient magnitude to impair health. Obesity is defined as the accumulation of adipose tissue that is of sufficient magnitude to impair health. Obesity is defined as the accumulation of adipose tissue that is of sufficient magnitude to impair health. Obesity is associated with several of the most important diseases of humans, including type 2 diabetes, dyslipidemia, cardiovascular diseases, hypertension, and cancer. Obesity is associated with several of the most important diseases of humans. Obesity is associated with several of the important diseases of the humans, including type 2 diabetes, dyslipidemia, cardiovascular diseases, hypertension, and cancer. Type 2 diabetes, dyslipidemia, cardiovascular diseases, hypertension, and cancer. Dyslipidemia, cardiovascular diseases, hypertension, type 2 diabetes, and cancer. It is associated with type 2 diabetes, dyslipidemia, cardiovascular diseases, hypertension, and obesity, and cancer. Obesity is a major public health problem in higher income countries and emerging health problem in lower income countries such as India. Obesity is a major public problem in higher income countries, major public health problem in higher income countries, and emerging health problem in lower income nations such as India. Major public health problem in higher income countries and emerging health problem in lower income countries such as India. So obesity is an emerging health problem in India, which is a lower income country. The two sides of energy equation, that is intake and expenditure, are finely regulated by neural and hormonal mechanisms so that body weight is maintained within a narrow range for many years. The two sides of energy equation, that is energy intake and expenditure, are finely regulated by neural and hormonal mechanism. The two sides of energy equation are finely regulated by neural and hormonal mechanisms so that body weight is maintained विदिन अ नैरो रेंज फॉर मैनी ईयर्स. ठीक है, बॉडी वेट को मेंटेन करने के लिए एनर्जी एक्सपेंडिचर का जो दो साइड्स है, दैट इज इनटेक एंड expenditure, that is finely regulated by neural and hormonal mechanisms. The two sides of energy equation, intake and expenditure, are finely regulated by neural and hormonal mechanisms so that body weight is maintained within a narrow range for many years. और ये जो न्यूरो हार्मोनल मैकेनिज़्म है जो कि एनर्जी बैलेंस को रेगुलेट करता है, इसका तीन कंपोनेंट होता है. न्यूरो हार्मोनल मैकेनिज़्म जो कि एनर्जी बैलेंस को रेगुलेट करता है, इट इज़ सब डिवाइडेड इनटू थ्री कंपोनेंट्स: पेरिफेरल और एफरेंट सिस्टम, सेंट्रल प्रोसेसिंग सिस्टम. पेरिफेरल और एफरेंट सिस्टम, सेंट्रल प्रोसेसिंग सिस्टम एंड इफरेंट सिस्टम. ठीक है, तो ये जो एनर्जी बेस रेगुलेटरी सर्किट है, एनर्जी बैलेंस रेगुलेटरी सर्किट है, इसका तीन कंपोनेंट है: एक सेंट्रल प्रोसेसिंग सिस्टम, एफरेंट सिस्टम और इफरेंट सिस्टम. एनर्जी बैलेंस सर्किट का तीन सिस्टम है, तीन कंपोनेंट है: एफरेंट सिस्टम, इफरेंट सिस्टम और सेंट्रल प्रोसेसिंग सिस्टम. क्लिनिकल कॉन्सिक्वेंसेस ऑफ ओबेसिटी. Obesity, particularly central obesity, is associated with increase in all-cause mortality. It is associated with increase in all-cause mortality and is a known risk factor for a number of conditions including type 2 diabetes, cardiovascular diseases and cancer. Obesity, especially the central obesity, is associated with increase in all cause mortality. It is associated with increase in all cause mortality and is a known risk of and is a known risk factor for a number of conditions such as type 2 diabetes, cardiovascular diseases, and cancer. See, obesity is associated with insulin resistance and hyperinsulinemia. Insulin resistance and hyperinsulinemia. Obese person have generally have hypertriglyceridemia and low HDL cholesterol level. So the triglyceride levels are high and the HDL cholesterol levels are low. Obese persons have triglyceridemia and low HDL cholesterol level. Triglyceride levels are high and cholesterol levels are low. Non-alcoholic fatty disease is commonly associated with obesity and type 2 diabetes. Cholelithiasis or gallstones is 6 times more common in obese than in lean patient. Obstructive sleep apnea and right-sided heart failure. Obstructive sleep apnea and right-sided heart failure. Marked adiposity is a predisposing factor for the development of degenerative joint disease such as osteoarthritis. Markers of inflammation such as CRP and pro-inflammatory cytokines like TNF are often elevated in obese person, particularly in people with central obesity. So inflammatory markers like CRP and pro-inflammatory cytokines like TNF are often elevated in obese patient. The basis for the inflammation is uncertain. Both a direct pro-inflammatory effect of excess circulating lipids and increased release of cytokines from fat-laden adipocytes have been proposed. The basis of inflammation is uncertain. Both a direct pro-inflammatory effect of the circulating lipids and increased release of cytokines from the fat-laden adipocytes have been proposed. Whatever the cause, it is thought that chronic inflammation may contribute to many complications of obesity, including insulin resistance, metabolic abnormalities, thrombosis, cardiovascular diseases, and cancer. Obesity and cancer, there is increased incidence of certain cancers in overweight people, including cancers of esophagus, thyroid, colon, and kidney in men, and cancers of esophagus, endometrium, gallbladder, and kidney in women. There is increased incidence of certain cancers in overweight people, including cancer of esophagus, kidney, colon, and thyroid in men, esophagus, thyroid, colon, and kidney cancers in men, and cancers of esophagus, endometrium, gallbladder, and kidney in women. ठीक है, esophagus और किडनी का कैंसर दोनों में कॉमन है. मेन में थायराइड और कोलोन कैंसर, वुमेन में एंडोमेट्रियम और गॉल ब्लैडर कैंसर. See, obesity is a disorder of energy regulation. It is a disorder of energy regulation. It increases the risk of number of important conditions such as insulin resistance, type 2 diabetes, hypertension, hypertriglyceridemia, which are associated to coronary artery diseases, certain cancers, non-alcoholic fatty liver disease, and gallstones. The regulation of energy balance has three components: afferent signals, the central hypothalamic system, and efferent signals. The regulation of energy balance has three important components: afferent signals, which are provided mostly by insulin, leptin, ghrelin, GLP-1, and peptide YY. The afferent signals are provided by insulin, leptin, ghrelin, GLP-1, and peptide YY. Central hypothalamic system, which integrates the afferent signals and triggers the efferent signals. Efferent signal controls the energy balance. Leptin, it plays a key role in energy balance. Its output from the adipose tissue is increased by the abundance of fat stores. Leptin plays a key role in the energy balance. Its output from adipose tissue is increased by the abundance of fat stores. Leptin binding to its receptor in the hypothalamus decreases appetite and increases energy consumption by stimulating POMC slash CART neurons and inhibiting NPY and EGRP neurons. See, leptin plays an important role in the energy balance. Its output from the adipose tissue is increased by the abundance of fat stores. Its output from the adipose tissue is increased by the abundance of fat stores. फैट स्टोर्स अगर अबंडेंट है तो लेप्टिन का जो आउटपुट है एडिपोज टिश्यू से वो इंक्रीज़ हो जाएगा. लेप्टिन आउटपुट फ्रॉम द एडिपोज टिश्यू इज़ इंक्रीज्ड बाय द abundance of fat stores. Leptin binding to its receptor in the hypothalamus decreases appetite and increases energy consumption. ठीक है, लेप्टिन अगर अपने रिसेप्टर से बाइंड करता है तो उसके कारण एनर्जी कंजप्शन इंक्रीज़ होगा, एपेटाइट डिक्रीज़ होगा. क्यों? क्योंकि वो स्टिमुलेट करता है पीओएमसी और कार्ट न्यूरॉन को. इट स्टिमुलेट्स द पीओएमसी स्लैश कार्ट न्यूरॉन्स एंड it stimulates POMC slash CART neuron and inhibit NPY and EGRP neuron. Inhibits NPY and EGRP neuron. तो ये है एनर्जी बैलेंस. ठीक है, एफरेंट सिस्टम में लेप्टिन, ग्रेलिन, इंसुलिन, PYY दे प्ले इम्पॉर्टेंट रोल. लेप्टिन जो है वो अपने रिसेप्टर से बाइंड करता है. ठीक है, ये जो कैटाबॉलिक सर्किट को एक्टिवेट करेंगे, एनाबॉलिक सर्किट को इनहिबिट करेंगे. कैटाबॉलिक सर्किट को एक्टिवेट करेंगे और एनाबॉलिक सर्किट को इनहिबिट करेंगे. कैटाबॉलिक सर्किट अगर एक्टिवेट होता है तो एनर्जी एक्सपेंडिचर ज़्यादा होगा और फूड इनटेक सप्रेस होगा. एनर्जी एक्सपेंडिचर एक्टिवेट होगा, फूड इनटेक सप्रेस होगा. and then the energy balance is maintained. लेप्टिन जो है ये POMC स्लैश कार्ट को एक्टिवेट करता है. ठीक है, जिससे कैटाबॉलिक पाथवे एक्टिवेट होता है और ये NPY EGRP को इनहिबिट करता है. POMC POMC CART को एक्टिवेट करता है और NPY EGRP को इनहिबिट करता है. POMC CART को एक्टिवेट करता है और NPY EGRP को इनहिबिट करता है. ठीक है, एक्सेस बॉडी वेट दैट इज़ ओबेसिटी के कारण इंसुलिन रेसिस्टेंस होता है. टाइप 2 डायबिटीज़ मेलाइटस. ठीक है, इट इज़ रिलेटेड टू मेटाबॉलिक सिंड्रोम, इंक्रीज एडिपोसिटी, ग्लूकोज इंटॉलरेंस, हाइपरटेंशन, डिसलाइपिडीमिया. ठीक है, ये सारे मेटाबॉलिक सिंड्रोम्स है. हाइपरटेंशन, डिसलाइपिडीमिया, ग्लूकोज इंटॉलरेंस, इंक्रीज एडिपोसिटी. ठीक है,